Good evening, everyone. On behalf of Yashoda Hospitals, I'd like to welcome you all to today's webinar on the topic inflammatory bowel disease during COVID pandemic. I'm Dr. Lakshmi, and today we have with us Dr. Kiran Peddi, consultant medical gastroenterologist from Yashoda Hospitals, Somaji. Dr. Kiran Peddi is one of the few gastroenterologists in the country with experience of working in 3 continents at consultant level. He also worked in world-class IBD centers, including Intestinal Failure Unit at Hope Hospital and Center for IBD for Western Australia. Welcome, sir.
Thank you, Dr. Lakshmi, for the introduction. So the importance of this topic is obviously originating from the day. So the day today being World IBD Day, we thought it might be a good idea to improve the awareness, especially in this COVID pandemic. What are all the management issues we should be considering in the management of inflammatory bowel disease? So as many people know, inflammatory bowel disease is characterized by inflammation involving any part of the digestive tract. So there are 2 categories of these diseases. One is ulcerative colitis, second is Crohn's disease. In Crohn's disease, any part of the digestive tract can get involved. For example, it can start with mouth, food pipe, stomach, small intestine, or even large intestine. Whereas in ulcerative colitis, only large intestine will be involved. The importance of this condition is that it's a long-term condition, like high blood pressure and diabetes. It is a long-term condition and it requires long-term medication on a regular basis. It is not possible to cure IBD at this stage, but with the use of proper medication at right time, we can achieve control of the disease. So in order to maintain the remission, and we need to have regular consultation with your specialist, which is extremely important. So this is a digestive tract, starts with the mouth and goes into food pipe and stomach, then small intestine, large intestine. These structures are supported by liver and pancreas. So different parts of the digestive tract has got different functions. As you can see, mouth is involved in biting, chewing, and swallowing. Food pipe, esophagus, is involved in transportation of food and prevention of reflux of chyme, which is semi-digested food. Stomach is the organ where most of the absorption of water and alcohol happen. Small intestine is the structure where chemical and mechanical digestion and absorption will happen. Large intestine again gets involved in absorbing electrolytes and vitamins. Rectum and anus in defecation. So it is a pictorial diagram representing Crohn's on the left side, where you can see it's a patchy involvement. It involves both small intestine and large intestine. Whereas the right side of the diagram is ulcerative colitis, which involves only large intestine. So in this particular picture, it involves left side of the large intestine. So what are the symptoms of IBD? If somebody is experiencing stools, the motions more than 4 to 6 times per day, watery stool, blood in the stool, pain abdomen, weight loss, and vomiting with low blood count, one should suspect IBD. Why the discussion on IBD is very important during COVID pandemic. When we had the first wave of COVID, all the IBD community, both doctors and patients, got worried because IBD patients have altered immunity. So there's something called inappropriate immune response of the body. And many of the medication used for IBD can also suppress immunity. So these are the reasons why the IBD community across the world got worried. What happens to our IBD patients, where they have more risk of infection? How are we coping with that? So let's see what happens. Then the other factors are IBD patients also require frequent hospital visits, and they also require frequent regular procedures, and also non-invasive tests such as CT scan. Like for example, colonoscopy is invasive test, CT scan is a non-invasive test. So how are we going to cope in the pandemic area where IBD patients, there is a concern that there might be increased risk of infection, and at the same time, IBD patients need to visit hospital multiple times, visit doctors multiple times, have to undergo tests and all. So how are we going to manage all this? We'll try to answer in some of the questions below. So what are the symptoms can IBD patients experience with COVID? So fever and cough are common symptoms of COVID, but IBD patients with COVID can have additional symptoms What are those additional symptoms? Is pain abdomen and diarrhea, increasing loose motions, pain abdomen. These may be very prominent in IBD patient with COVID. And when somebody known to have IBD comes to me with increasing abdominal pain and increasing motions, my confusion or any other doctor's confusion would be, are we dealing with flare-up of IBD or is it COVID-related diarrhea? This is the confusion which prevails. But obviously we need to take help of other investigations. Like example, a CT scan of the chest might tell you that patient may have COVID. RT-PCR, obviously it is there. And in addition to that, some body pains, myalgias, and some vague symptoms can be predominant features in patients with COVID rather than IBD flare. So what I try to do is I try to address the common dilemmas which are prevalent in IBD community in this particular COVID area. So one of these questions is, do IBD patients have excess risk of severe COVID compared to general population? As I said, when the first wave started, all of us got worried, assuming that our IBD patients will be at a higher risk than general population. But till date, there is no proof to say that IBD patients have higher risk than normal to get COVID. So that means even if you have IBD, please do not get worried that you'll be at higher risk of getting COVID. So far in the last 1 year or so, we haven't seen any evidence, any proof to say that our IBD patients are at a higher risk. In fact, there are a couple of studies done in Netherlands and some other countries, European countries, which actually show the risk of IBD is slightly lower, risk of COVID, sorry, is slightly lower in IBD patients compared to normal population. And even if you were to get COVID, please do not get worried whether the COVID will be severe or mild. It will be same risk as somebody else without IBD. So a non-IBD patient getting COVID and an IBD patient getting COVID, there is no difference to say that the IBD patient will be at a higher risk. If you're an IBD patient but don't have COVID yet, so the common confusion is, should I be stopping my IBD medication? Because IBD medications are immunosuppressants, immunomodulators. So if you are on IBD medication but don't have COVID, please do not stop your IBD medication. Because number one, there is no recommendation to say that you should stop IBD medication to prevent COVID. And if you stop unnecessarily, you're at risk of getting IBD flare, which can be even more difficult to manage in this pandemic. You have to continue all the medication, but if you're on higher dose of steroids, please discuss with your doctor or a specialist and try to reduce prednisolone to less than 20 milligrams per day. The next dilemma of our IBD patients are, I'm an IBD medication and tested positive now, COVID. So previous scenario was you're on IBD medication, but you're thinking about stopping medication as a preventive strategy. But here, you're already on IBD medication, you tested positive for COVID. Then what you should do? So if you're on medications such as azathioprine and 6-MP, you should stop them. If you're on biologics such as infliximab, adalimumab, or vedolizumab, then you have to postpone your next injection. If you're on a high dose of steroids, then reduce the dose to less than 20 milligrams per day, but please discuss with your doctor before you do so. If you're on newer agents such as tofacitinib, then you should stop them. The next dilemma is, I have an IBD flare. Can I start the medication for the flare during COVID pandemic is the dilemma. But if you have an IBD flare and you're not having COVID, the flare of your IBD should be treated exactly the same way. So there is no need to differentiate between these two. So it has to be managed as per the protocol. If you're an IBD patient in need of surgery, can I undergo surgery during this pandemic? Obviously, if you're in need of surgery, the surgery requirement can be categorized into 3 types. One may be an urgent surgery requirement. If you require surgery urgently, please do not hesitate. Please go ahead, select your center, go ahead and get the surgery done. But if you are thinking about a routine surgery, please postpone to a later date. And in between, you may have a situation where, well, I can't postpone forever and I don't have to rush. Please get the surgery done as soon as a clear date is available for you, a possible sooner date rather than postponing indefinitely. Now, you're an IBD patient, you're on a medication, you're tested positive for COVID. I just now said that in such scenario, you have to stop IBD medication. But when will you restart? Because restarting is also extremely important. If you stop your IBD medication for long term, you may end up with IBD flare. So when will you restart them? So there are two strategies for restarting your medication. One is symptom based, second is test based. So in symptom based, you have to wait at least 10 days from the onset of your first symptom. For example, you have a fever on 1st of June, for example. You have to wait for 10 days. And in those 10 days, last 3 days have to be symptom free. So 72 hours or 10 days plus 3 days, it may be. So maybe 13 days. So you have to wait for at least 10 days, but it also should include at least 72 hours of symptom free period. The other strategy is test based. So you have to have 2 negative RT-PCRs before you restart the medication, in addition to the 10-day rule as well. So if you have to stop the IBD medication, you have to test yourself, get 2 negative RT-PCRs, then restart the medication, or at least wait for 10 days and plus another 2 or 3 days, and make sure you are symptom free for about 3 days before you start the medication. So what about pregnancy and IBD? So if you are an IBD patient who happens to be pregnant, are you at a more risk of COVID compared to non-pregnant IBD patients? The answer here is yes. So if you happen to be IBD, known to have IBD in your body, then you become a pregnant, then the risk of acquiring COVID is higher. So if you acquire COVID, that the chance of that being severe is higher. But mind you, there is no significant data available to support this theory, but the perception is you may end up with a significant course of COVID. So you have to take extreme precautions for that. And if you are an IBD patient and pregnant, one of your family members got tested for COVID, then please be aware that you need to follow very strict isolation precautions, because you don't want to get COVID being pregnant and being an IBD patient. So the three will be little cumbersome combination. So, but in the unfortunate event of a COVID IBD patient, IBD pregnant patient becoming COVID positive, the treatment would be more or less same, but at the same time, we have to stop your IBD medication, and we have to be aware that all these three conditions, whether it's IBD, whether it's pregnancy, whether it's COVID, all these three conditions can increase the chance of clot formation in your lungs and legs. So special expertise should be taken, special opinion should be taken from hematologists about managing blood thinning medication in this situation. So if you happen to be IBD positive, IBD mother, COVID positive, can you breastfeed babies? The answer is yes, but you have to take strict precautions in terms of hand hygiene, and mother should be wearing a clean mask. So you don't have COVID, but you have IBD, and you are worried that your IBD may flare up. So how do you monitor your IBD activity during this pandemic? You have to minimize hospital visits because there is always risk of acquiring COVID, but please make use of online consultations. And instead of going for colonoscopy frequently, you can opt to a temporary switch to blood test and stool markers, for example, fecal calprotectin, temporarily, till there is a requirement for a definite colonoscopy or till pandemic is done. You may be taking biologic infusion, like for example, infliximab or vedolizumab, and you may also require iron infusions. So is it safe to take them? The infusions are safe. There's no problem in that. As I said before, if you're in biologic injections, the next dose of injection should be postponed a little bit. But mind you, when you go for biologic infusion, when you go for iron infusion, you're at risk of exposing yourself to hospital environment and other COVID patients. So it's still safe to take, but you just have to follow social distancing, sanitation, mask. But you can't avoid your injections, which are required. So with all the precautions, it's perfectly safe to go to hospital and take the injections. Now, the most controversial or most debatable issue, can IBD patient take COVID vaccines? Now, All the current COVID vaccines which are available across the world, there are non-live vaccines. Can be taken and should be taken by all IBD patients irrespective of their medication. Because you don't want to get COVID if you're an IBD patient. So please do not avoid COVID vaccines if you're an IBD patient, because all of these are non-live vaccines. They will not cause any harm even if you're on medication. But actually the situation may be other way around. For example, if you're on immunosuppression for your IBD, you're on azathioprine or some other immunosuppression, even if you take vaccination, your antibody response may not be perfect. So you're taking vaccination, but the response may not be perfect. So that means you may not be completely immune to COVID. Why the reason for this is because the immunosuppression you're on, that will suppress the antibody response to COVID vaccine. So never miss your second vaccine, because even if you take second vaccine, don't feel that you're completely immune. Please do not forget your precautions. Continue to take all the precautions, including social distancing and masking and everything else. And be aware that your immune response to COVID, despite taking 2 vaccinations, may not be perfect because you're already on immunosuppressants. But taking vaccine is a must, and but be prepared that you may still be not immune for COVID. What about any other vaccines? Now, vaccination in IBD patients is extremely important. A lot of IBD centers started vaccinating patients, and it has to be followed in a stringent methodology. All IBD patients should be assessed for whether they're taking immunosuppressants or not, that they can take live vaccines or inactivated vaccine, and annual flu vaccines, pneumococcal vaccines are very important. In addition to this, you may also require varicella zoster vaccine, you may also require MMR vaccine, but please discuss with your specialist about taking vaccination if you're on IBD and IBD medication. But if you're on IBD medication like immunosuppressants, you have to avoid live vaccines, but you can still take inactivated or non-live vaccines like flu and pneumococcal. So ladies and gentlemen, in summary, IBD patients should be extra vigilant with the usual precautions. They should stay in close follow-up with their doctor and should not stop any of their medication without doctor's advice. COVID vaccines are highly recommended along with flu vaccine and pneumococcal vaccine. Thank you very much.
So thank you, sir. So let's take a few questions what we have got on our social media platform from our viewers. We have one question. Doctor, what is the most important things the young generation should do to keep the bowel healthy?
This is, I think, a common debate in many families nowadays, because a lot of kids are getting used to junk food and regular foods and other things. So very good question, very relevant question. So the answer is the timing is one aspect. You have to eat regular food on regular timings, and avoiding breakfast is very common, but Phillies do not do that. So taking time is very important. And taking a balanced diet, a good mix of fruits, vegetables, proteins, carbohydrates, fats is extremely important. Once in a while, if the kids are wanting towards junk food and all, that's okay, but it should not be on a weekly basis. It should be on very odd occasions. So healthy diet on healthy timings, good sleeping habits, very, very important.
So talking about the diet, sir, is there any specific diet what one should follow for patients who are diagnosed with IBD?
No, again, very commonly debated question. And the scientific evidence says that elimination strategy is the better strategy. That means if you know that a particular food is aggravating your symptoms, you need to identify and avoid it. But if you're not sure any particular food is causing your flare up your symptoms, please do not restrict to all your medication, all your diet. So continue to take a good balanced diet. If any particular food is aggravating your symptom, try to identify and avoid it.
Okay. The next question we got, what causes IBD and what are the treatment options for this?
Okay. So there are multiple reasons why one gets IBD. The factors include genetic factors, environmental factors, and immune factors, infections, and geographical factors. So whatever the factors are, the common culprit is inappropriate immunity against infections. For example, in a genetically risk-dependent patient develops inappropriate immunity, gets an infection into intestine, and the body doesn't produce appropriate immunity. It either produces over-immunity or under-immunity. So in a patient who are already at a risk of developing IBD, if this inappropriate immunity kicks in, then that might lead to inflammatory bowel disease.
So, the next question, why is IBD becoming more common in our India? Is that got something to do with the diet or the genetic factors?
Yeah, I'll answer this question. I didn't answer the second part of your last question, Dr. Lakshmi, which is the medication, which I'll come to that in a minute. So now 10, 20 years ago, we used to think that IBD would never exist in India. But in the last 10 years or 15 years, we are seeing increasing number of IBD patients in India. And now India stands at around 1.5 million IBD patients across the world. This is the second highest number across the world. And the number of cases increasing in IBD is phenomenal. And the projected number of IBD patients in 10 years down the line might be number one cases across the world if you take Indian IBD patients. So the reason for that may be change in the lifestyle, change in the stress pattern, stress factors, change in the dietary factors where we started using more of westernized diet, contaminated food, and all these reasons. So, and there is also a risk of transatlantic migration. So people who are migrating across the borders to US and India, UK and all, transatlantic migration is also thought to be a risk factor for IBD. Now, coming to your previous question, Dr. Lakshmi, what medication are to be used for IBD? There are different medications. The common medications are 5-aminosalicylic acids, like known by trade name of Mesacol, Vegazori, Coolgut, and lots of other things. These are the basic medication. Next set of medication is called immunomodulators, azathioprine, 6-mercaptopurine, and methotrexate, all those things. The next level of medication is biologics, like infliximab, adalimumab, and vedolizumab. And next treatment might be a surgery. In ulcerative colitis patient, surgery might involve removing the entire colon. In Crohn's disease patient, surgery role is only for treating complications. For example, if there is a stricture of the intestine, surgery would be to remove the stricture. Now, in addition to all these treatment options, now we are very much familiar with steroids. Steroids can be life-saving in IBD, and they are extremely useful for pushing into remission. What is remission? Remission is a phase where patient will not have any symptoms. So IBD patients, the treatment options would involve treatment targets would involve pushing into remission and also maintaining that remission. Steroids are extremely useful in pushing into remission, but not useful in maintaining the remission. And so all these options are available, but when to use what depends on the doctor to doctor and experience to experience. So your doctor should be able to tell you what is the best strategy for you, which medication should be used when.
So moving on to the last question for this day, sir. We have a viewer asking, what are the most common symptoms and when should I suspect of having IBD? Okay,
good question. So the common symptoms of IBD, whether it's ulcerative colitis or Crohn's, the common symptoms are diarrhea, so loose motions and blood in the motion, mucus in the stools, and these are very commonly seen in ulcerative colitis. Whereas in Crohn's disease, the common symptoms are pain abdomen, growth retardation in children, anemia, still can have diarrhea, and fever, weight loss. So all these can be a presenting symptom of IBD. So if you have any of these symptoms, please do not ignore and get evaluated urgently by your specialist, because what happens a lot of times is in India, people keep saying that, well, I got chronic amoebiasis and all. So, but these has to be investigated by investigations, colonoscopy, CT scan, blood test and all. Then once the disease is confirmed, the treatment would be easier. If we start the treatment in early stages, we can prevent a lot of complications of IBD, especially in Crohn's disease.
So thank you, sir. This brings us to the end of this session. Thank you very much for your time.
Thank you very much, viewers, and thank you, Dr. Lakshmi.
Thank you. Do join us for the next webinar. Thank you all.
Bye-bye.